With my mom, we found a full spectrum cannabis oil given 2 to 3 times a day in food to be very helpful for her tough behavioral symptoms. Ingesting cannabis oil tends to last 4 to 6 hours, but the onset is slower than under the tongue or inhaled.
But laboratory research on cannabis is slow, expensive, and highly disincentivized.
Essentially, the most effective research on cannabis is being done by handfuls of brave, leading edge clinicians and desperate, frustrated family members across the country, but particularly in California. That big, amazing medical cannabis conference Alzheimer's panel we were so excited to hear didn't include any clinicians using cannabis medicine at the time.
But when they opened it up to audience questions, a general practitioner, Dr. Jeffrey Hergenrather, was the first to the microphone. And he shared his incredible experience working with people living with dementia in assisted living facilities and at home in Northern California.
Dr. Hergenrather has used plant medicine throughout his long and distinguished career and works with many clients who've been using full-spectrum cannabis oil for years, including seniors with age-related issues, especially with dementia.
In 1999, Dr. Hergenrather co-founded with Dr. Todd Mikaria, the Society of Cannabis Clinicians. On the SCC website, there's a search tool where you can find a knowledgeable cannabis medicine doctor in your area and those who do telemedicine.
There are also educational resources, a research library, videos, and courses taught by experts in the field.
In this clip, Dr. Hergenrather shares his theory on the effects of an aging endocannabinoid system and his ongoing practice with seniors.
The endocannabinoid system wears down. It just isn't the same as you get older as it is when you're young. And it may explain a lot of the changes that we find as we age, because people that otherwise didn't have problems like that at all in their younger years, and then they get to be elderly and now they're not sleeping very well at all. Now they're very anxious, and anxious where it's not good. It's go to the hospital with anxiety, kind of anxiousness. And these people may not have been anxious in their youth. And pain is harder to control. And really a number of other conditions that are modulated or that are mitigated by the endocannabinoid system jumping into action. And when this system isn't working as well in the elderly, we know that 2-AG and some of the natural cannabinoids aren't found in the same concentrations in the elderly and in Alzheimer's dementia. So we have evidence that this system's wearing down. And so we can use cannabis to our benefit to augment that natural system. It just makes sense. Well, my association with a local psychiatrist, Dr. Phil Grobe, we connected with the owners and the managers of this facility and the nursing staff, and probably most importantly, the nursing staff was really favoring the idea of using cannabis medicine. So we began to intervene by saying, okay, let's try 5 milligrams of THC or 10 milligrams of THC, or let's blend it with THC and CBD. And we began to kind of work toward medicines that seemed to work best. And as the patients would present with agitated behaviors, psychiatric problems of significance, the families were asking for medications. They were asking the psychiatrist to intervene and see if we could help. And it turned out that the cannabis was really working better than anything else. Now, if I'm doing this with somebody in my office, I might say, okay, let's just start with 1 milligram of each. You're not going to feel this. I just want you to get comfortable and confident in using this. And then in a few days or next week, we can double the dose to 2 milligrams of each. And then we may go to 3 and 4 and 5. And over the course of a month or even more, we'll adjust the dose to find what works. And they develop the tolerance much more slowly. I can't tell you how many people I have that come to me saying, we want the CBD.
Yeah.
You know, it's like they've been hearing the media, they've been understanding that maybe CBD is the medicine of cannabis. The public thinks that THC is dangerous in many cases. So a lot of my role is to explain, we can try CBD as a dominant molecule. In medical marijuana grown for CBD, the high CBD strains, I let them know right off that it may be 20 to 1 CBD to THC. It might be 30 to 1 It might be 18 to 1, depending on the product line. But it's predominantly CBD, but it's a whole spectrum of molecules, and it works better with that whole spectrum of molecules. And don't be shopping on the internet for pure CBD. It's not really what you want.
Find the full episode on iTunes, Spotify, Anchor FM, or any of your favorite podcast platforms. And look for Cannabis Helps Dementia on YouTube.
And we recently published a book, CBD for Seniors, 12 Things to Know When Trying CBD or Medicinal Cannabis to Ease Symptoms of Aging and Improve Brain Health.
A short guide with a long title to give you the tools you need to feel comfortable trying CBD or medicinal cannabis. You can buy our book on Amazon.com as an ebook and in paperback, or contact us at alsnotes.com for private coaching and education.
Wishing you all the best on your journey.